Hi, thanks everyone for tuning in to Diffuse the Confusion in Coding Injections and Infusions. So today we'll be reviewing coding guidance, some directives, and additional references on injections and infusions. My name is Victoria Hernandez, and I'm honored to serve as your speaker on our drug administration topic. Our goals and objectives for this presentation are these bullets. Okay, so let's have a quick refresher on some basics here. Very important terminology and descriptions involving injections and infusions that we need to familiarize ourselves with. And to continue on our terms, okay, so the two pictures on the left side, that's your IV piggybacks. On the right side is your IV push. On this slide, we have the why, what, and how questions that are important to validate, especially with our injections and infusions. Doctor timed, that is mainly used for clinicians. So it's actually a best practice in validating the 6 rights. I like that. 6 rights of safe drug administration. So that's the acronym they use. So there are 3 main categories in our whole injection infusion world. Just a quick FYI when assigning codes and looking for, the complete documentation, the complete picture of the services being provided. Another just good reference on the hierarchy. So this is straight from AHIMA. Another little sample tip sheet, just instead of flipping through your book, at least have your good reference sheet, especially if you have multiple drugs to assign codes to. It's just a quick reference sheet which helped me a lot. You may customize yours based on your notes, your references, and whatever types of records that you code. Okay, so let's move forward with the definitions and instructions on initial. Okay, next, the subsequent. So most likely a bulk of your code assignment would be on these subsequent services. Now there's also concurrent service, and these are used as an add-on code. So these will never be assigned as an initial. And speaking of hydration, these are the 2 codes for hydrations. Just some good points to know about hydration services. Okay, some examples of solutions used in administration of hydration services. Now, medical necessity for hydration services. Now, intramuscular and subcutaneous, there are other intramuscular and subcutaneous injections that have specific CPT codes. Okay, so now let's look at the coding itself. For IV push, remember this is that up to 15 minutes one. Also in the IV push section though is 96376. Okay, now moving to infusions. So these are the longer ones. 96365 is the initial in the infusion world. So it's up to 1 hour. 96367 is additional infusions of a new drug up to 1 hour. So that's a new drug. And the 96368 is concurrent and more on infusions. 96369, this is subcutaneous infusion for therapy or prophylaxis, another add-on code. So when you see the plus, let's remember in CPT, that's always an add-on to another code already assigned, never to be assigned initially or by itself. The application of on-body injectors. So this is was a new code in 2017 is when it was introduced. Okay, let's talk modifiers. So we already know our old friend here, modifier 59, and it's interesting because this is actually one of the most over-reported modifiers, and it actually results in overpayment. And our more fairly recent are the modifiers XE, XS, XP, and XU. Have to know your guidelines. Just be careful and really look into those, especially the most commonly administered drugs in your facility. And this is an example of how to appropriately report them. Now, on those, knowing now that the insurance companies are not going to pay for drugs not used, so this is where we may apply the modifier JW. Modifier JW is used on a Medicare Part B drug claim to report the amount of drug or biologicals that is discarded and eligible for payment under the discarded policy. And a lot of CPT assistant references for y'all. So Yes, just feel free to look at those. Okay, let's jump to our scenarios then. Okay, scenario 1. I also entered the name of the drug and the time on whatever code assigned was matching with. Next one. Okay, we're okay there. Scenario 3. This scenario is just purely solely hydration services. Case 4. Okay, let's look at our codes. Okay, number 5. So this is an example of which one was done first versus the hierarchy. Okay, number 6. All right, let's see. I think this is the last one. Which CPT code should be assigned in this scenario? We have here an infusion. Okay, quickly talk about audits. Let's look at some of the factors to consider. And next, more on it. Focus. Are we looking at specific coders, or let's say new hires, or specific physicians, specific department, audit assessment? So these are things that we need to remember, and other factors to consider. Okay, conclusion and action plan. And just some reminders. These are some good references and tips for both coding professionals and auditors. And okay, these are the resources and references. With that, thank you everyone, and have a great rest of the day. Thank you for tuning in. Have a good one.